Now I'd like to introduce Dr. Sally Wetzel, who will deliver opening remarks. Dr. Wetzel completed her MD degree at the University of Florida and spent many years at National Jewish University of Colorado before moving to the University of Pittsburgh. She is currently director of the University of Pittsburgh's Asthma and Environmental Lung Health Institute at UPMC and is the chair of the Department of Environmental and Occupational Health at the Graduate School of Public Health, University of Pittsburgh. Dr. Wetzel has been NIH funded for most of her career. She has focused on improving the understanding of the development and treatment of asthma and its phenotypes. Translationally, she has studied molecular mechanisms underlying these phenotypes. Dr. Wetzel has published over 250 papers and has received numerous achievement awards from the American Thoracic Society and the European Respiratory Society. In her role as chair of Environmental and Occupational Health, she is dedicated to improving the environment and its impact on lung health. Welcome, Dr. Wetzel.
Thank you very much, Christine, for that very nice introduction. And it certainly is my privilege as chair of the Department of Environmental and Occupational Health, to once again, through the University of Pittsburgh Graduate School of Public Health, serve as the host for the 9th Annual Conference on Unconventional Natural Gas Drilling in Public Health, sponsored by the League of Women Voters, as part of their ongoing Straight Scoop on Shale initiative. I think it's really important, as always, to start out by taking this opportunity to thank the League of Women Voters for sponsoring this program for 9 consecutive years. The League of Women Voters has recognized the importance of this issue to Western Pennsylvania for quite some time now, over 10 years, starting with the Indiana chapter and followed soon by our own Pittsburgh chapter. As we moved past the turbulent 2020 election and hopefully avoidance of any of those things in the future, I think it is more important than ever to remind everyone that the League of Women Voters plays a critical role in ensuring the integrity of our elections with their long-standing efforts to help monitor ballots and polling places, something they have been doing for nearly 100 years. We all know that this effort will remain extremely important over the next few years, particularly with the emerging and increasing potential for erosion of voting rights. Now, the League of Women Voters has never been afraid to take on controversial topics and always to present them in the most fair and balanced way possible. In addition to voting rights, their homepage includes efforts on immigration, healthcare reform, and the environment, all of which certainly come with their own controversies. While shale and unconventional natural gas drilling remains publicly controversial, this conference may be one of the last bastions of nonpartisan efforts in an area of such importance in the U.S. today. Suffice it to say, fracking is not going away in Pennsylvania anytime soon, despite a few people's efforts. Oil and gas prices are at some of their highest levels in years, which makes fracking all the more economically attractive. We live in a region where economic health of the population has often been considered more important than the clinical human health aspects. So questions remain about whether it is possible to develop unconventional natural gas drilling safely, both locally and globally. In fact, we are still really in the early days of this drilling, with much more evidence remaining to be collected. Over the years, these Straight Scoop on Shale conferences have provided a venue for lots of differing topics, from fundamental information on the unconventional natural gas drilling process itself, including the engineering and geology that underlies extracting natural gas from tight shale formations, and as well as the health aspects. Over the next 2 days, this year's conference will tackle issues around health research, the convergence of research with regulatory policies, as well as emerging and urgent issues with various toxicant exposures arising from fracking, including forever chemicals and methane, things that really deserve a good deal of attention. We will also have a session on community voices and the active roles and methods by which community can be involved in understanding, identifying risk, and then in potentially regulating unconventional natural gas drilling. This year's sessions will specifically drill down in new areas of exposures, including PFAS, per and polyfluoroalkyl substances, oil and natural gas produced water, as well as new potential regulatory efforts, which might minimize them, converging on the issue of whether economic and environmental forces can beneficially coexist. The results of these conferences have led to a tremendous accumulation of invaluable information available through the League of Women Voters website. This is largely built on an unshakable belief in the value of evidence-based research. While that concept seems as American as apple pie as we approach Thanksgiving, for many, these very principles of evidence-based research are still under attack. Probably nothing as obvious as the false beliefs associated with the COVID-19 pandemic, with the masks and the vaccines. Social media, with all of its positives, has contributed to this situation, and its role is felt in the spreading of misinformation in nearly all controversial areas. This conference remains an attempt to override this misinformation, to promote science and to promote reason. Thus, it is of critical importance that academic institutions like the University of Pittsburgh and the Graduate School of Public Health and independent fact-based organizations like the League of Women Voters do all we can to uphold the values of science, facts, and evidence-based conclusions. With COVID's gift of the world of Zoom, which is probably one of its most important gifts. There weren't many, but this is probably one of the most important ones. We are even better able to invite speakers from around the country. Over half of our speakers are from outside of Pennsylvania, and to enhance our nationwide audience. The presentations we will hear today will center on where we are today and direct us into the future. We are actually still at the cusp of investigations of a new and potential health hazard. Indisputable evidence may not yet definitively exist one way or another, and only continuous, accurate, science-based, prospective, and retrospective collection of data will move us ahead. Remembering, of course, that the health of citizens of our region, and in fact, our country and the world, lies in the balance. I look forward to 2 interesting and productive days of presentations, discussions, and moving forward together in our understanding of this incredibly important area. Maybe next year we will be at least partially in person again. Thank you very much, and I wish you all a wonderful conference.